The doctor told me to cut sweets. The doctor told me to go walking. The doctor told me to go swimming. She said I can't be putting on 1 kilo every week. It's her who's been telling me what to do and what not to do all this while. And just to prove it to you, I have her on my show, my ultra cool Gynaec, Dr. Nidhi Sapolia. So question number 1.
So you can start shooting.
Yes. Yeah.
Yes.
Exactly.
Yes.
Okay. See, I told you she's ultra cool. Yeah. Hi, doctor. How are you?
I'm good, Varana. How are you?
Yeah.
Okay.
Okay, I'm okay. You know better. As for me, you know, you've been with me since my last pregnancy.
Yes.
You've been with me through my DNCs, so you know my history. I know it's going to get a little difficult when there are going to be questions that are going to be case to case different.
Correct.
But I'm sure you're going to give them the best possible answer.
Okay. So you can start shooting.
Yes. So question number 1, the most common that has come yesterday on social media is Dr. VBAC.
VBAC. That means the vaginal birth after cesarean.
Okay.
See, it depends upon the reason of cesarean. Why was the cesarean done in the first place? So if the cesarean was done for some very simple reason like fetal distress, malposition of the baby, then you can always go for a vaginal birth. But main thing is it has to be only one cesarean. 2 cesareans, it has to be a cesarean, 100%.
So I'm clearly out of the game.
Yes.
What is the ideal age gap one should have between
2 cesareans
cesarean.
or after
the first
cesarean,
cesarean,
yeah.
of course.
It has to be at least 2 to 3 years,
Okay.
not less than 2 years. If it is less than 2 years, you cannot go for a vaginal delivery.
Okay. And there's also something I remember from my last time that the doctor said I have a small pelvis. So,
Small pelvis means no vaginal delivery.
okay, so clearly out of the league.
Out of the league.
2 C-sections done. I have a small pelvis and VBAC's not happening. But yes, to all of you who asked about VBAC, there's your answer. And now for the most hyped, the most asked, weight gain. I mean, none of us really want to gain weight. How do you control this?
Ideal weight gain during pregnancy for the full 9 months is around 12 kgs.
Gone. I'm gone. Yeah.
So that means that initial first 3 months you may even lose weight. Don't worry about that.
Okay.
After that, from the 4th month onwards, the minimum weight gain per month should not be more than 2 kgs.
But now you tell us about those mothers who actually go around and gain 20 to 26 kgs. Now what?
If you gain more than 15 kgs, the chances of diabetes, blood pressure and difficult delivery, all those things they start. It becomes a high risk pregnancy.
Okay.
So now how to avoid it?
How do you not gain so much weight?
It's very simple. You have to eat healthy, avoid junk food, avoid all those carbonated drinks, drink a lot of water and exercise.
When do we start exercise, doctor, and what are the best forms of exercise?
The safest exercise during pregnancy is walking and swimming. Okay? But it depends. If you had a previous high risk case like miscarriages or bleeding during pregnancy or anything, then it is better to avoid or consult your doctor what exercises to be done and when to start. If no high risk factors are involved, then you can start exercising right from the first day of pregnancy.
Yeah,
Yes.
exactly. When I have made a hole on my bed the first 4 months and not moved at all, now I know the reason of again. But I want to talk about those mothers who actually don't exercise and they just don't do anything.
If you have never exercised in your life before pregnancy, then just go for walking. That's it. Don't try to start something new during pregnancy because you may hurt yourself and have injuries.
And doctor, also just a quick thing, is it true that exercise during pregnancy helps to lose weight faster afterwards?
Yes, because your muscles are toned up.
Okay.
Your body is in the phase of exercise. So basically, if you're out of exercise after delivery, you cannot start immediately.
Okay.
Your muscles are all loose and hanging in flabby body. If you start exercising with that, you will injure yourself.
How fast after your C-section can you exercise, number 1? And also, is a C-section transformation possible, just like a vaginal delivery transformation as regards to your body?
It is possible. See, there is no difference between a cesarean or a vaginal delivery except for the way of birth.
Okay.
It is a myth that after a cesarean you have to lie down in the bed, you cannot move, you cannot do exercise or anything. No, it's not like that. The day you are painless, you feel comfortable, start walking. Okay, I'm not telling you to start going to the gym immediately, but yes, you can start walking immediately.
Then mood swings, what do you do with them?
Just tell your husband to be more patient. That's it.
Yeah, I think I'll first play it in my house 10 times and then have it played outside. But yeah, okay. What is the apt age to have your first pregnancy, and what advice for people who are getting married late and even planning a baby later?
It should be before the age of 34. That's it. Okay. If you are getting married late and you're planning for a late marriage, it is better to go for egg reservation. You can get your eggs retrieved and frozen so that whenever you are planning to get married or getting pregnant, you have the younger eggs, because as you age, your eggs are getting older.
I just hope culturally nobody beats me up for this, but how many years should you ideally keep a gap of after your marriage to have a baby?
See, it depends upon the conditions of marriage, and if there is no medical condition or anything, then ideally the girl should have enough time to adjust to the new environment, to the new family, and then she should plan for a pregnancy.
See, I told you she's ultra cool. Yeah. Yeah, and
if there are medical conditions, then it is better not to wait and go for it immediately. Like for polycystic disease or for hormonal problems, as you're aging, the hormonal problems, they increase.
Contraception. What is the most effective, the most sought after, the most safest contraceptive?
Contraceptive is a very, very wide and a very difficult topic. Actually, I cannot summarize it in a very few words. It is basically tailor-made. Okay. It depends upon your how much gap you want to put, whether you want to go for a next pregnancy or not, whether you have medical problems or not, how was your delivery, was it a normal delivery or a cesarean. So depending upon all these factors, you have to go for the contraceptive.
Okay.
There are a lot of contraceptives which are available in the market, and you can actually tailor-made it for the patient needs. That's it. So it's much better you can go and discuss it with your doctor and then go ahead with the contraceptive.